Hi, everyone. Welcome to our Week 6 legislative update. Tim, Jacob, another tough week in Pierre. How would you describe what took place this past week?
I'm not sure there's words, Steph, but I do know the Beard Brothers are back for Week 6 podcast. Made it through probably the toughest week of session, I would say. Kind of things are really, obviously tensions rise because people are tired. You had a lot of bills get killed, bills passed you didn't want to get passed. So there's kind of a tension in the Capitol. But I'd say we're overall, knock on wood, in a pretty good place. We were able to not in committee, but I feel confident on the floor. By the time people view this, we will have killed a couple of COVID and other vaccine anti-vax bills. There's two of those that are hitting the floor this afternoon. We feel pretty good about working the floor. I think we'll stop them again, but it's kind of that relentless attack we keep talking about against vaccines and frankly a little bit of healthcare overall. So overall, we had a good week, but long, busy week.
Yeah. I think the only thing I'd add is we did see the COVID blood donation bill. That one went down in flames in the House floor earlier this week, and so that was really good to see. And I think we'll have a similar vote with those two vaccine bills this afternoon. Next week is crossover day, and so I think that's part of kind of the wear and tear that everyone's feeling, is that all these committees they had long schedules, lots of things on the agenda in committee and on the floor, just trying to get through that deadline for next week.
Yeah, I know, Jacob, you mentioned Senate Bill 233 and lifting that up. What do you want to share about that particular Senate bill?
It was heard in Senate Health earlier this week. It was looking at the relationship between insurers, participating providers, and non-participating providers. And essentially what it was trying to do was put some protections in place so that the insurers don't have to force the participating providers to get the non-participating providers in the network. I think that's the easiest way to explain it. I thought we had a lot of good arguments on that one. I think the committee had a tough decision to make, I guess, at the end of the day. We did lose that bill. Something that, during it, we heard from the opponents on that bill that they want to get together this summer and have some conversations. And so we look forward to those conversations, and we'll kind of decide from there if there's something next year maybe that we have to try and come back with another solution.
I think you'll likely see that come back up next year. And I think a year's worth of data will help maybe prove our point. And I feel pretty good about that next year if we have to do it. So we'll see how the summer plays out.
Yeah, and there's similar bills going on. Well, in Indiana, there's one that I think we can watch that and see how that impact is. And then down in Iowa, they have a similar topic, more meaty bill that they have down there, but certainly a topic that won't end with this year.
We've been working very closely with the administration on methodology, the proposed change to Medicaid methodology, and just had some really fruitful conversations with the administration. They've just been great partners to work with, and I think we're going to come to some resolution there. I think if you remember before, we had a lot of losers in the shifting of that methodology and a lot of winners. Our goal all along is to still have winners and make sure our losers aren't losers. And I feel really confident that we found a solution and feel pretty good about that path forward.
Yeah. And I think, with that, we're also still hearing a lot of talk about 1% increase for the big three. There is some rumblings of 1.25%. I think that's coming from the legislators themselves. I'm not sure. I think some of those plans involve cutting some current budgets, and I don't think that's something that we would really want to see. But I think at the end of the day, we'll let them have that discussion on how much the amount is, but feel very confident at this point of 1%, which going into session we thought 0%. So happy there, and happy that that's continuing forward.
Yeah, it was nice to see the revenues come in above a couple of months, and I think they feel better about that things have stabilized on that front, and I think we're headed in the right direction.
Hey, what are some of the key bills that you'll have your eye on next week?
Yeah, we still have the healthcare property rights bill, I would call it. House Bill 1105, I believe is the number on that one. And so we're going to see that one on the Senate side this next week. I think we're going to have some additional opponents coming in to help us support defeating it, right? And so feeling pretty good about that one. Overall, we're down to, with these two vaccine bills today, we're down to 4 bills left on our opposed, which we started at 18. So I don't know how we got this far this fast, but I feel like we're in a good spot.
Yeah, can see the daylight, I think, now.
Yeah.
So,
We will leave it right there. Again, thank you for all that you guys do, and we'll see everyone else next week.